We are seeing similar case counts for the coronavirus infection last week compared to the week before, but perhaps some evidence that the outbreak at Temple is subsiding. Here are the numbers. Since this time yesterday, we've identified 43 additional cases of the coronavirus infection in Philadelphia residents, bringing this to a total of 34,741 since the beginning of the epidemic. Now, for the past week, the week that ended Saturday, September 5th, counting by the data which the test was run in the laboratory, we averaged 109 cases per day. Now, with case report delays, that we'll likely see an increase in that number in the next few days. But right now, that number is similar to the 108 per day that we saw the week before. Also last week, an average of 4.2% of the people who were tested positive. That's a slight increase from the week before. Unfortunately, I can report today we've had no new deaths identified from the coronavirus infection. Our total since the beginning of the epidemic is 1,763. But remember that we get data on death in batches, and so we would expect to hear about more later this week. Where we are in testing, last week we tested about 2,600 people per day. We're still having a slow turnaround time in one laboratory, that is to say Quest, but there are more sites than ever where people can be tested. You can go to our website, www.phila.gov/testing, to see all the different sites where you can get tested and the details on how to access that site. Our mask use numbers are looking very good. Last week, more than 90% of people in retail stores that we observed were wearing masks. That number is definitely protective. It's something we're very pleased to see. I want to thank Philadelphia residents for taking this so seriously and learning how to wear masks. It's not that difficult, but everybody's really taking this up. It's great. What you're doing is saving lives. Now, I'll give you an update on our college-associated cases. Around the United States right now, we're continuing to see outbreaks in many colleges, and we're seeing case rates rise in several states, what appears to me to be related to this. Here in Philadelphia, the Temple University outbreak appears to be subsiding. Case counts have appear to be falling in the past few days. And Temple University conducted testing over the weekend. They did about 150 students per day, and they saw a decreasing percentage of those students who tested positive each day. So far, there's no evidence of spread from the Temple University population to other populations in the city. It's a very good thing. I want to thank, again, Temple University for its very quick action to control this outbreak. And let's hope that the subsiding that we're seeing right now continues. However, I'm still very concerned about the spread, the potential spread at colleges here. Social gatherings appear to be the greatest risk. We continue to hear about parties that were reported to us by a number of students where there's at least one student who tested positive. Several of those parties were organized by fraternities and sororities. Even if these parties are relatively small, if people are not wearing masks and they're getting together indoors, they can set up very rapid spread. So we're asking all the colleges in the area to do whatever they can to prevent these situations. Now, as the mayor said, as of today, we're allowing restaurants to reopen for indoor dining and theaters to reopen with restrictions. And we're asking those organizations, the restaurants and the theaters, to follow the safety standards which are on our website. The key points are this: for restaurants, for indoor dining, no more than 25% capacity. Okay, so there's lots of space between diners. The diners have to be more than 6 feet apart from each other and different tables. Everyone in the restaurant needs to wear masks except when they're seated at tables eating. There's no bar service and no alcohol served except as part of a meal. And the staff must wear masks as well as face shields. The theaters, there's a limit to 25 people inside, and there's no food or drink allowed to be served. Now, unless these precautions are taken, these are high-risk situations. That's why we have these precautions. So we will take these standards very seriously. We are sending staff to restaurants to educate them about the standards. We're also having our inspectors check the COVID safety precautions as part of their routine inspections. If Philadelphia residents see restaurants or theaters that are not following these standards, we ask everyone to call 311 and let us know. We will send inspectors out to verify and educate, and if necessary, we will close places down if they're out of compliance. As you may have heard this morning, the governor announced that he will allow expansion of restaurants from 25% capacity to 50% of capacity effective on September 21st. This just happened this morning. We will review the governor's policy change and consider what we'll do here in Philadelphia. But the restaurants in Philadelphia should not assume that we will just follow the governor's policy change here in the city. As the city that was hit hardest by this epidemic, we have been more restrictive in the state in a number of areas in the past. And we will continue to be more restrictive if we feel it is necessary to protect Philadelphia residents. Now, I know all these safety precautions are difficult. I know it's difficult to maintain these. but we need to continue to limit how we get together to avoid getting more cases and more deaths. So the advice to everyone is avoid gatherings, wear a mask when you're near others, and that includes when you're near your relatives and includes when you're near your friends. Avoid gatherings even when you're talking about gatherings with your relatives and your friends. This is especially important for people over the age of 65 or people with chronic medical conditions. More information on everything on our epidemic is at our website, www.phila.gov/COVID. Thanks.
This is for Dr. Farley. You alluded to declining case numbers at Temple over the weekend. Can you share specific numbers about the number of cases and the positivity rate there? And then also wondering, given that there is often a time lag for when new cases start to show up, how confident are you that Temple's outbreaks still might not later spread to the surrounding community?
Yes, the numbers we have on the number tested, the number positive we have from Temple, and so I prefer you to go to them to get the original source there so we don't misreport that information. As to the second part of your question, all I can say is that the numbers appear to be subsiding over the past few days. I definitely am not saying that this outbreak is over. There could be an increase from here. So we're pleased to see the numbers where they're going right now, but I'm not going to say for sure that this is over.
Thanks. And second question also for you, Dr. Farley. I mean, having seen what happened at Temple and what has been happening across the country in college towns, effectively, where there have basically been in numerous cases sort of instant outbreaks upon return of students to campus. Do you think it was a mistake for the health department to sign off on Temple's plan to bring students back to campus this fall?
I don't think so. I would say that we underestimated the risk of the students who were off campus and out of the control of the university, and how quickly we could get an outbreak occurring in that population. Still, it appears that there was a relatively small fraction of the total number of students that were involved in this, and it does. We're optimistic right now that the numbers appear to be subsiding. So I think it was the appropriate thing to do at the time. I think that Temple made the appropriate decision to go to all online in the wake of this. And we are in close communication with the other colleges around the city. Now that we recognize this risk about taking extra precautions, we want to be as close as possible to normal operations here. And if we can do things safely, we want to try to do that.
Dr. Farley, the question is for you. She's asking how the city intends to deal with the uprise in cases after this long weekend, and if this is going to affect the opening of restaurants.
Restaurants are still allowed to reopen as of today to indoor dining with restrictions. And although we did see an increase in case counts in the early part of last week, the numbers were falling over the latter part of last week. So that has not changed our plans.
Dr. Farley, the question now is a follow-up. What would be the numbers that would justify closing up restaurants again?
We haven't put a number on it. I would say if we see a sharp rise in the case counts or a sharp rise in the percent positive, that we would consider and evidence that dining at restaurants was related to that we would consider closing restaurants. But we haven't set a specific number on that.
This is a question in general for the city. If there is a knowledge of the number of restaurants that have had to close due to the pandemic.
I don't have it.
No contamos con esa cifra en estos momentos.
I mean, we can try to get it. I mean, is she talking about close? Well, everybody had to close.
No.
Estamos hablando de que todos tuvieron que cerrar, pero me imagino, Shaira, que te estás refiriendo a los que cerraron para no volver a abrir, ¿verdad?
Exactly, yes. That had to permanently close because they were so impacted economically.
We don't have that. Well, at this point, I don't know if we have that number yet because we just started to reopen. So we don't know who's going to reopen, who isn't. There are restaurants that have the capacity to reopen indoors that have told me personally they're not going to do it until the weather starts to turn colder because they want to stay out. They want to stay outdoors, and then as it gets colder, see how the numbers are going and open up indoors. So I don't know if we have a definitive number of restaurants that have ceased to exist until we have another month or so of open and indoor dining.
If I could add to that, I don't think we're going to ever know that number because the restaurant industry, restaurant business is always high risk. There are restaurants that close all the time because they simply fail to make it as a business. And it's not going to be possible to say that this one failed because of COVID versus this one failed just because they couldn't make a living at that location given the service they do. So we're not going to be able to give you a number on that.
Okay, thanks. And I also have a question for Dr. Farley. With more reopening and colleges reopened, are you hopeful that the city, like it sounds like in the last 2 weeks, cases were about the same. Are you hopeful that we'll continue to see a decrease even as you see more reopening, or are we likely to plateau at some point?
It's really very difficult to predict. And I can't say whether we're going to see increases because of more things reopening, or because in the fall season, most respiratory viruses get worse, or we'll see a decrease because people have learned how to deal with this epidemic and they're wearing masks. It could go either way.
One question for Dr. Farley, and it relates to Temple University. I know you guys had talked about the risk of community spread, not really evidencing itself with people moving off campus, but what's your recommendation to students who are on campus now? Should they stay there or should they go home? Is there concern about students who may make the option to go home in the next few weeks?
We are encouraging students to go home rather than having a large number of people off campus here in the city. However, that needs to be done very carefully. And we've given very specific guidance to Temple to disseminate to its students about how to do that so that they don't bring the infection home with them and pass it on to their parents. That they can get, depending on the situation, the student could get tested or the student could quarantine before they go home. But over the longer term, we do think it's safer if those students, they don't need to be in Philadelphia if they were to go home.
All right, thank you very much.
Thank you. Dr. Farley, how does Temple's numbers stack up to Drexel and Penn's numbers and University of Science?
Are you talking about numbers of students or number of positive cases?
Number of positive cases.
We've had, I'm not aware of positive cases at Penn or Drexel, but again, we have difficulty identifying whether a case is a student. We know that the name of the person who has a positive test, but they don't have their student label on them. And so with Temple, we heard anecdotally about a number of cases, and so we made real efforts to identify those students who were Temple associated.
What steps have the city or Department of Health explained to Temple that they must take in respects to driving these numbers down, that unequivocally that you're not going to allow? Well,
we each university, including Temple, had a safety plan, which we worked with them on and said you need to do things, for example, they need to be wearing masks in class. They need to be keeping a distance, minimize the number of students in class. They need to put a space between students in the cafeteria. That included many features also about the on-campus residential sites, the dormitories. The problem that we saw here was that students who were off campus that were not in any area that the university controlled. And so there was nothing we could require Temple to do. We said, do what you can to try to discourage social gatherings amongst those who are off campus. And they did what they could, but they were not able to prevent all those social gatherings. There's a limit to what we can require. And as we saw with a very large number of students living off campus, that just became too high risk a situation.
Lastly, the governor issued that statement. I'm not sure if you addressed it in your opening words or not, but the issue that the 50% occupancy is what Pennsylvania can allow restaurants. Will the city be following that recommendation or staying at 25%?
Yeah, I did mention that in my opening comments, and I said that we'll review it. It just came out today, but the restaurants should not assume that we're going to go to that. We have been more restrictive than the rest of the state in the past because we're the highest risk city. And if we think it's appropriate for us to be more restrictive, we'll continue to be that way.
Good afternoon, everyone. And I'd like to direct my questions to both the mayor and Dr. Farley. What part, if any, did the advent of Restaurant Week play in the decision to open restaurants to indoor dining this week? And will Restaurant Week be something that you monitor? Is there any special monitoring you're going to be doing as part of Restaurant Week?
So,
There was nothing from my perspective on Restaurant Week. We had, I think, decided on the 8th because it was after Labor Day weekend, which would have been potentially a situation where lots of people would have been congregating in lots of places indoors. So we thought that the 8th was more prudent, but Doctor can speak for his analysis.
That is the answer.
Oh, wow. I got smart.
Okay. Also, when it comes to things like Restaurant Week, is there like because it's such a bigger event over and above what we normally do in terms of indoor dining, are there any plans to have, like, say if you see something that really, really freaks you out, like a special number you can call other than just 311? Because sometimes I was out and about last weekend and I saw a group of outdoor diners on 17th Street that weren't necessarily socially distancing. So I'm wondering, is there anything that's going to be put in place to kind of keep a tighter eye on Restaurant Week now that you can go indoors?
The best thing for people to do is to have it route those calls through the regular route. Call 311. We're prepared for that. And so if we hear of anything that's unsafe, we'll send an inspector out there.
Yes, Dr. Farley, how concerned are you that the clearing of the encampments on the Parkway and Ridge Avenue and the dispersing of its residents could lead to spreading the coronavirus, considering the CDC guidance recommends against clearing encampments?
Well, first, I should clarify, if you look closely at the CDC guidance, they don't just say don't clear encampments. They say take into account the totality of the risk of the situation, that there are other health risks besides COVID of a group of people living outside, perhaps in poor sanitation, or they could transmit other diseases or have other health problems. But we're concerned whenever people get together, there's a risk of COVID spread. But with homeless people, there's a risk, a variety of risks. Right now, the shelters, we're seeing no cases essentially in the homeless shelters. So I'm not particularly concerned that there's going to be an increased risk of COVID for them if they go from the encampment to a shelter. The shelters already have a variety of steps in place in order to prevent spread in those facilities, including social distancing and masking and testing where appropriate. And those are going to be applied to anybody who goes into a shelter.
If I could jump in as well, and for people who are particularly vulnerable, that is over the age of 65 or with underlying medical conditions, we have space available at our COVID prevention sites. And I think over 30 individuals who were staying at one of the camps have already gone to those sites, and we have additional room. So individuals in that situation who are particularly vulnerable can go to there.